Hey guys, I'll now be talking to you about the plank progression test. This is a 3 progression plank test which will help me to evaluate your anterior core strength as well as your hip stabilizers, quadratus lumborum, thoracolumbar fascia. The first step would be just get down into a normal plank. So you will maintain proper spinal curvature, have your back flat like a table, and then just hold this position for 30 seconds, or until you start to fail and sink your hips like this. Once you start to fail and sink your hips, stop the time and record it. If you can hold that position for 30 seconds without sinking your hips or failing, you can move on to progression 2, which would be to incorporate movements into your plank, such as a flutter kick in this sense. So you will get down into the same plank position and just simply flutter kick out, pause at the side, come back, other leg, come out, pause at the other side, and then come back. So now I will now demonstrate that. So get down into your plank and then come out, stop, out, pause, out, pause, out, pause. If you can do that for 30 seconds, you now pass stage 2 of the progression test. If you cannot and you start to fail and sink your hips, stop the time and record it. If you can pass that and hold your position for 30 seconds, we will now move on to stage 3 of the plank progression test, which is incorporating more movement into your plank, such as arm crawls, front, back, back. So this will be the same plank. Get down and you will move your forearms up, down, and then flutter kick out to the side, flutter kick out to the side, like such. I'll demonstrate. So here, plank, front, back, side, and then again, front, back, side. That one's a little more difficult. If you start to fail there and you drop your hips, or don't maintain the proper spinal curvature and the straight spine, then you will record your time then, and then you're done. But if you can hold that for 30 seconds, then you have passed all 3 stages of the plank test, and you have excellent muscle endurance and muscle strength. If you cannot do these exercises, then I will recommend some corrective exercises you can incorporate into your workout that will help you to do better on these specific tests. Alright, so the first one is a wall plank. So this is very simple. You'll put your forearms on the wall and then lean your body weight against the wall as such, keeping your spine straight. So now I'll demonstrate it. Forearms on the wall, and then just lean towards the wall. You're keeping your back straight. If that's too easy, we will move on to a chair plank. Preferably, you should be using a chair that does not move, but in this case, we don't have that, so we will be making do with what we have. So we will put our forearms on the base of the chair, and then maintain a proper spine as such, holding this position for 30 seconds. If that's too easy, you can change it up and move and switch out the chair to a Swiss ball, which will help you to incorporate more core stability, since the Swiss ball is not a immovable object. So those are the 3 corrective exercises. I would also suggest foam rolling. I would foam roll the glutes right back here, and I'll demonstrate that. So I would foam roll the glutes because the glutes help you to maintain a proper spinal alignment. So you would grab a foam roller, put it right underneath the one butt cheek, lift that leg up, cross it over, and then just roll out the glutes. Roll them out. Make sure they're nice and loose. And then you'll switch legs and do the exact same thing. You should roll these out for about a minute, finding any hot spots and staying on them. The other place that I would suggest foam rolling is if you see any abnormalities in your client's abs. For example, if they start to sway this way or sway that way, I would foam roll the side of the abs that they are swaying towards. So if you're coming this way, instead of staying straight, just simply roll out this side of the quadratus lumborum. And those are the corrective exercises and foam rolling techniques I would recommend for somebody that is doing the plank test. Thank you.